afternoon, everyone. Thank you for joining us for the Fedele F and Iris M. Fauri Memorial Lecture. Before we begin, I just want to go over a few housekeeping notes. If you wish to receive CEs for today's webinar, you will need to stay for the duration of the time and respond to all the poll questions you see pop up throughout the presentation. You will see the first two momentarily. There will be time for Q&A at the end of the event, so please submit any questions you have in the Q&A box or the chat. We do encourage participation in the chat throughout today's presentation. We're just going to wait a few more moments to get started, so sit tight and remember to respond to the polls when you see them appear on the screen. Here are your first two polls. You should see them appearing on your screen, so go ahead and respond to the polls. I'll give you a little bit of time to do so, let you guys get used to this as we are going to be doing it throughout the presentation. And remember, participating in the polls is required to receive CE credits for today's presentation. If the poll is not working for you, go ahead and put your answer in the chat. Thank you.
Good afternoon, everyone. I'm Lynn Vadecka, Dean of the School of Social Work at the University of Michigan. It's my true honor to welcome you today to the Fedele F and Iris M. Fauri Memorial Lecture. Just in case you don't know, this is Michigan Social Work Centennial Year 2021. We're celebrating 100 years of social work at Michigan. We had a wonderful reunion weekend celebration last week, and it was exciting to see so many alums and friends in person. And the centennial celebrations aren't over yet. You can take a look at the Centennial website and find a full calendar of fall events. Today, we start our Centennial Lecture series, and it's a real honor to do so in Fedele Fauri's name. Part of the Centennial is to celebrate our founders and the people who transformed the school. And Fedele F. Fauri is indeed a dean who had the vision for the excellence of the school as we know it today. Under Fedele Fauri, the doctoral program was created. He had a vision for science and research in our field, and he put into place excellent educational programs that serve the public by examining and preparing social workers to solve the most important social challenges of our society. Before I pass the podium on to Professor Todd Harrenpal, I want to take a moment to thank the Fauri family for their generous gift that makes this lecture possible. We really appreciate that we can hold this anticipated event, highly anticipated event every year due to your generosity. Thank you. So thank you to David Fauri, Greta Fauri, and Lauren Thompson, who I believe are with us today, for your continued support. I now will turn the podium over to Todd Harrenpal, Marion Elizabeth Blue Professor of Children and Families at the University of Michigan School of Social Work. Todd.
Thanks so much, Lynn. It's good to be with you all here today. We appreciate your taking the time to join us. So the focus of the Fauri Lecture today, this year, is on economic policy and child welfare, with a particular emphasis on research, policy, and practice connections, as well as community-based and applied research. Few would argue that the impacts of the COVID-19 pandemic have exposed to an even greater extent the challenges that exist within our child welfare systems and the limitations of current policy approaches relevant to the health and well-being of children. At the same time, the pandemic has energized efforts to respond, and our presenters have, to a one, committed themselves to advancing policies and practices that have potential to dramatically change the supports available to most children, vulnerable children, and their families. For that, they should be commended. We have an exciting lineup for you today. We have 3 different panels. Actually, the first is a single presenter, Dr. Whitney Rost, who is the Director of Research and Services at Casey Family Programs, and formerly with the Division of Violence Prevention at the Centers for Disease Control and Prevention. Whitney will present on her research on the benefits of child tax credits and the implications of the expanded child tax credit under the American Rescue Act of 2021. Our second panel is composed of 3 presenters. Suzanne Greenberg will lead off. Suzanne is the Executive Director of the Michigan Children's Trust Fund, and she will talk about their commitment to supporting research to understand effective strategies for preventing child maltreatment. Dr. Katie McGuire-Jack from the University of Michigan School of Social Work will follow Suzanne. And Katie will present on her current partnership with the Michigan Children's Trust Fund on a project titled Increasing Access to Earned Income Tax Credit to Reduce Adverse Childhood Experiences. And the third presenter of that panel, Rachelle Smith, will present on her agency, SOS Community Services, and their commitment to participating in research that informs practice and policy. The third panel includes Dr. Meg Feely of the University of Connecticut and her colleague, Michelle Riordan-Nold, who is the Executive Director of the Connecticut Data Collaborative. Together, they will present on a project to enhance data literacy as a tool for social change. Their work is based on a university agency community partnership model in the state of Connecticut. And then finally, we will have our esteemed colleague, Dr. Brenda Jones-Harden of the University of Maryland, provide some perspective on the topics that are presented. She'll share her wisdom about the issues that are discussed and raise additional considerations for our consideration. She and I together, Brenda and I will together then moderate a question and answer period at the end. So again, I thank you for being with us here today. We're very glad to have you and to be presenting on these topics. And without further ado, I'll hand it over to Dr. Rost. Whitney.
Thanks, Todd. Let me just pull up my slides here really quick. Sorry about that. Yeah, thank you, Todd, and good afternoon, everyone. It's a pleasure to be with you here today. As Todd mentioned, my name is Whitney Rost. I'm a Director of Research Services at Casey Family Programs in Seattle, Washington, and I'm excited to talk to you today about the child tax credit and child well-being. And to kick us off, I'm going to start us off with a poll question, which is a true or false statement. The federal child tax credit has always been refundable. So while you guys are plugging in your answers, I'm going to move into why we should be moving upstream to improve child well-being. So as you all probably know, there's a large body of research linking income and child well-being. Children in poverty are more likely to experience a range of adverse outcomes, including greater risk of involvement with child protection systems. Poverty directly influences child well-being through its impact on limited access to quality healthcare, education, and housing, and indirectly through its impact on safety, stability, and parenting, and we know poverty is a strong predictor of child welfare involvement and child maltreatment risk. And while we've enjoyed a steady decline of physical abuse over the past several decades, rates of neglect have remained relatively stable. They've been pretty stubborn to move. And as a previous mentor of mine said, this is in large part because as a society, we've never really demonstrated the political will to tackle the conditions that lead to neglect. And this includes poverty. But we also know that changes in income can be strong predictors of child well-being. So increases in income, increases income through, for example, more generous earned income tax credits and child support payments have been associated with reductions in reports of child protection, while losses of income, for example, through reductions of child welfare benefits, have been associated with increased risk of involvement with the child protection system. So why should we be prioritizing environmental changes? As many of you in the child welfare field have probably been hearing over the past several years, there's been a lot of advocacy for embracing a public health approach to our work. And I think that the public health impact pyramid developed by the former CDC director, Dr. Tom Frieden, really demonstrates why this is the case. So this health impact pyramid, as you'll see, shows the potential impact of different levels of public health interventions. So as we move down the pyramid, we increase our population impact. And when you move up the pyramid, it increases the individual effort needed. So really at the base of the pyramid is where we have our biggest bang for our buck, which we address when we address those socioeconomic factors and other social determinants of health, because we can reach more of the population. As we move up the pyramid, it increases the individual effort and the resources needed, and we simply do not have the resources or the bodies to reach all of the families in need. So if we really want to have the greatest population impact, we really should be paying attention to socioeconomic factors and other social determinants of health. Speaking of social determinants of health, I think this is the importance of socioeconomic conditions is further reinforced by the World Health Organization's conceptual framework for the social determinants of health. And what you're seeing here is that framework adapted to be specific to child abuse and neglect, which was done by my colleagues, Marilyn Metzler and Joanne Clevens at the CDC. So moving right to left, I know it's kind of a lot in one visual, but hopefully we can work through it together. Moving from right to left, we see the inequities in child abuse and neglect that we observe in our data. This data comes from the 4th National Incidence Study. And here we can see a much greater risk for child abuse and neglect among African-American children compared to white children, and a much, much higher risk of child abuse and neglect among those who have a low socioeconomic status compared to a non-low socioeconomic status. They then identified those more proximal risk factors for child abuse and neglect, or those intermediary determinants of health. And these include things like poverty or low family income, parental unemployment, residential instability, living in a high poverty neighborhood, or living in a high violence neighborhood. Those conditions are then greatly influenced by your socioeconomic position. And really, we're talking about the socioeconomic position of groups, which are determined by your education level, your occupation, your income, or your wealth. And those are further delineated by race and ethnicity, socioeconomic status, and gender. And our socioeconomic position, or where we fall in the social hierarchy, is greatly impacted by the socio-political and economic context. And things, relevant to child abuse and neglect, these include things like education funding, mortgage lending practices, hiring practices, and how the justice system operates. And I would also add here how we implement socioeconomic policies. So both those kind of frameworks really show us why we should be paying attention to socioeconomic factors and the policies and programs that impact them. So socioeconomic policies have huge implications for the conditions in which parents raise children. So here today, I'm here to talk to you about the child tax credit, something we've probably all been hearing a lot about. There's a lot of exciting things happening with the child tax credit, but I'm just going to go through the history. It looks like a lot of you got that poll question right, that the child tax credit has not always been fully refundable. The child tax credit was enacted in 1997 as a non-refundable tax credit to help working families offset the cost of raising children. In 1997, it was about a 500 tax credit, so it would reduce the tax filer's tax liability by that much. It was non-refundable, meaning that if your tax liability was reduced by the credit, but you still had credit left over, you didn't receive the full benefit of the credit. So it was really targeted early on to middle and upper middle income families. It was expanded in 2001 to be partially refundable to families earning more $10,000 or more dollars, and in 2009 to families earning $3,000 or more. And this allowed the benefit to be available to more lower income families, but still excluding many of the families that need it most, which are disproportionately families of color. In 2017, the Tax Cuts and Jobs Act doubled the credit to $2,000 and made up to $1,400 of it refundable. So this is a partially refundable tax credit prior to what the child tax credit that's being implemented today. So compared to the earned income tax credit, there's far less research on its impact on child maltreatment and well-being. I think this is in large part to the fact that very few states have a state level child tax credit. When we're doing research on the earned income tax credit, we really harness that variability across the states that have state level EITCs. With the child tax credit, there's only 6 states that have adopted a child tax credit, and they haven't been consistent in their implementation of that child tax credit. So you can see the states that have at one time adopted a state level child tax credit: California, Colorado, Idaho, New York, North Carolina, and Oklahoma. And those tax credits vary in eligibility, the funding amount, and refundability. With regards to those state level child tax credits, they're usually a portion of the federal child tax credit. And because the federal child tax credit historically hasn't been that generous, state level child tax credits are really even less generous and probably don't have a lot of impact on on families' economic security. So it's just been a very difficult policy to study in the past. But when I was at the CDC, we attempted to evaluate the child tax credit and its impact on child well-being. So in this study, we examined the effectiveness of the federal child tax credit at reducing child injuries requiring medical attention, a potential indicator of child abuse and neglect, and behavior problems, which are a risk factor for both child abuse and neglect and youth violence. So I'm going to go quickly through this because I have more exciting research to share in a moment. But just really quickly, the data that we used was the National Longitudinal Survey of Youth in 1979, which follows the lives of a sample of American youth born between 1957 and 1964. It asks about a range of really labor labor, education, work experiences. But for the purposes of this study, we relied on marital status, number and age of children, and their income to determine if a mother was eligible to receive a child tax credit in that year of the survey. We also used the NLSY 79 Child and Young Adult Survey, which follows the lives of the children of the female respondents in the NLSY 79. It also asks about a range of experiences, including, education outcomes, household, employment, things like that. But for the purposes of this study, we focused on injuries requiring medical attention and behavior problems. And for the child tax credit, our independent variable, which was the child tax credit, we exploited those policy changes that went into effect in 1998, 2002, and 2009. And we coded 0 for years prior to its introduction in 1997, and if a mother did not qualify. And this allowed us to do some fixed effects models to estimate the potential impact of child tax credits on our outcomes. So we controlled for year and state fixed effects. The year fixed effects allowed us to control for temporal shocks that are common to all of the states, while the state fixed effects allowed us to adjust for variation in different levels of benefit of public assistance programs in the states, the adoption of state level CTCs, and other time invariant differences across the states. We also controlled for various child and maternal demographics, the child age and sex, maternal education, weeks unemployed, number of children in the household, and income, all potential predictors of our outcomes. And then we clustered our standard errors at the level of the family to account for multiple children being surveyed for one mother. So what we found, and I'll just reiterate, this was a study that just looked at whether a mother was eligible for the child tax credit, not whether she actually received the child tax credit in that year. But we found that the non-refundable and partially refundable child tax credit for families earning $10,000 or more, that should say or more, that's an error, that those were not related to our outcomes, but the child tax credit did become related to injuries and behavioral problems when it became partially refundable for families making $3,000 or more. So we found that children of mothers eligible for the child tax credit were less likely to have injuries requiring medical attention and had fewer behavioral problems, but only when that partial refund was extended to families making as little as $3,000. And I just want to reiterate, we did the best we could with the data we had available to us. But again, we weren't able to determine whether mothers actually received the child tax credit. We were just able to determine whether they were eligible. So what could the changes in the American Rescue Plan Act related to the child tax credit mean for child well-being? Well, we're already starting to see a lot of those benefits, which I'm going to discuss momentarily. So under the American Rescue Plan Act, the child tax credit has been increased, the maximum credit has been increased for families of up to $3,600 for younger children, 0 to 6 years old, up to $3,000 for children 6 to 17 years old. And it also makes the child tax credit fully refundable, which makes it available to the lowest income families, which had previously been excluded. And as I mentioned before, that disproportionately affected children of color. It also allows for monthly advance payments, essentially a monthly child allowance. Those payments started in July and will run through December 2021. And why these monthly advance payments are so important right now, obviously, there's been a lot of economic consequences to families, and allowing for monthly advance payments ensures that families don't have to wait till next year to receive the benefit. And it's estimated that this version of the child tax credit will reduce child poverty by 45%. We're already starting to see the impact of this child tax credit. The first payment, research out of Columbia showed that the first child tax credit payment in July kept 3 million children out of poverty. And the second payment in August kept an additional 500,000 children out of poverty. So between those two payments alone, 3.5 million children have been kept out of poverty. We also see positive impacts on food insufficiency. So this is out of the Household Pulse survey, and we can see kind of across for all adults, there was a reduction in the portion of adults who were reporting food insufficiency. But when you look at the adults in households with children, that's a much larger reduction in the share of the adults who reported food insufficiency. Similarly, we see that the share of adults reporting difficulty paying household expenses was reduced. Again, a slight reduction for all adults, but a larger reduction again for those adults in households with children after those child tax credit payments went out. So I'm now going to talk about the potential for this child tax credit, the potential impact of this child tax credit on the child welfare system. So this is a project that we've been working on for a couple years in partnership with our colleagues at Columbia University and at the University of Wisconsin-Madison. So you can see the team listed there. And this project was really an effort to look at the effects of child poverty reductions on Child Protective Services involvement and placement into out-of-home care. And what we did in this study, as many of you may be aware, a couple years ago, the National Academy of Sciences released a report, a roadmap to reduce child poverty. And in that roadmap, they came up with 4 different packages of social policies and their potential to reduce child poverty. And so you can see how the different policies that go into each of those 4 packages, expansions to the earned income tax credits, expansions to the child care tax credit, increasing the minimum wage, and then we see in packages 2 and 4, the introduction of a child allowance, which is really what we're experiencing today. And you can see the largest reductions in child poverty happened in that fourth package of social policies, which includes the introduction of that child allowance. So the aim of this study was to simulate the reductions in Child Protective Service involvement and foster care placements that are likely to result from the implementation of 3 of the NAS policy packages. We only looked at the second, third, and fourth policy packages. The first policy package didn't reduce child poverty as much as the other 3, and also it included a new program that was primarily targeting men, so likely would have less implications for child welfare involvement. And in addition to the introduction of a child allowance, again, the proposed policy packages included reforms to the EITC, SNAP, and the federal minimum wage, among others. So what did we find? We found that implementing the policy changes proposed in the NAS report could have substantial effects on families at risk of involvement with child welfare systems. We found that about across the 3 packages, we could have up to 1,023,528 fewer CPS investigations, over 247,000 fewer substantiated reports, and up to 52,000 a little over 52,000 fewer removals, fewer children going into care. And we looked at these differences by race and ethnicity, and we found that the social policy expansions were particularly salient for children of color. And that is really due to the introduction of the child allowance. So the child allowance was introduced in packages 2 and 4, as you can see here. And while 2 has less of an impact on the poverty reductions, it has more implications for child welfare involvement because the child allowance more readily distributes income to lower income families who are at higher risk of CPS involvement. And that, again, disproportionately impacts children and families of color. And with that, I will turn it over to Katie and her team.
Hi, everyone. I'm Suzanne Greenberg, and thank you so much first, Whitney. I just want to say thanks for that great information from the Casey Family Programs. Katie, if it's okay, I'll just jump right in to use every second possible. I am Suzanne Greenberg, and I am the Executive Director for Michigan Children's Trust Fund and the State Lead for Prevent Child Abuse in Michigan. And I'm honored to talk with you today a little bit about how we are preventing child abuse, but also why this research and this relationship is so important. First, I think the bottom line is, for those of you who may not be familiar with the Children's Trust Fund here in the state of Michigan, our mission hasn't wavered since 1982. We are focused on the prevention of child abuse and neglect. And we do that in a variety of different ways. We fund and support over 100 programs that focus on both primary and secondary prevention. You're going to hear a little bit more about that from one of my esteemed colleagues and one of our great treasured partners in this work. But before we do that, I want to share that the importance of our work is to go way upstream. It is to work with families before ever having any connection to the system or having any abuse or neglect involved. If indeed there has been abuse or neglect, that indeed there's no open cases, that we are working with this family right now, that our goal is to keep children happy, safe and healthy in the home with their parent or caregiver. So one of the things, just if I might speak very candidly, when I came to this position after 25 years of working in child abuse prevention up in the Great Lakes Bay region, I was very convinced that we needed the entire state to refocus. And what I was not knowledgeable about was the importance of research. I knew it was going on all around me, and I certainly was reading about the great research that was being done through a lot of different sources that, like Casey Family Programs. But what I didn't have access to as a smaller organization was funding that sort of amazing research. And when earlier, gosh, I don't even know exactly what it was, but about a year and a half ago, almost 2 years ago, when I met Dr. Katie McGuire-Jack, it was the enthusiasm and the passion with which she was concerned about the need for more prevention, that this was a way that we could really stem the tide, change the lives of our children. It was very exciting for me to see that this sort of research and other research that she exposed me to was just the way for us to additionally fund and expand the work that we were doing. So it means something to me personally, and I want to share that with you because I have always been on the side of social work of the doing and being an administrator, and had never been on the research and data side, except when required. And what I'll say to you is that the balance of both is what makes the impact best for our families. And I see that every day, and now am always searching for opportunities for us to do additional research. One of the great gifts to the trust fund through this project was that the current research assistant at the time, Atticus Solomon, was working side by side with Dr. Jack. We were getting to know Atticus and getting to work closer with them and understanding the benefits of having someone on our team who not only knew how to manage data, but loved it, and also understood the benefits of research and shared that. And so frankly, we were very blessed when we were getting into this project that I was able to hire Atticus at the end of their time as finishing their master's degree. Voila, yay, able to hire, and now is a member of our team, which has really shifted the way that we look at data and research. At the same time, because the University of Michigan is such an amazing organization, we had a new research assistant in Callie Finzel join Dr. Jack. And so now we had another individual who was working with us to further our understanding, to answer questions for all of our programs, because we were able to work together with our programs to provide the research opportunities that Dr. Jack and her team needed in order to further this hypothesis that we could really make a difference in preventing child abuse through the increased awareness of the EITC. All of that to say that my experience in working together with researchers has been extraordinary, and I think the bar has been held really high. And if I might add for one moment that you'll hear from each of us, and certainly the rest of the panel, I'm sure, that where our passions lie and what the work we're doing, we're super enthusiastic about it. And that when we come together and bring those passions together, it's really been, for me, quite an eye-opening experience, and I look forward to additional research down the road. We are intending to utilize the results of this research and to take that to our board of directors, whom are appointed by the governor, to decide on our future funding. And if indeed everything turns out the way that we expect it to, we look forward to doing that so that we can have that, frankly, new prevention strategy to prevent child abuse from every corner, all 83 counties of the state. So I want to wrap up so that my colleagues have every minute available to them, but just know that the tremendous work you're doing, whether it's on the data research side or whether it's on the clinical side or macro side, that social work is indeed valuable and so important. And to tell us more about that, Dr. Katie McGuire-Jack, take it away.
Great. Thanks, Suzanne, so much for that wonderful presentation. It has really been an honor for me to be able to work with the Children's Trust Fund here in Michigan and to have that work be celebrated at the the University of Michigan. So I'm not great at multitasking, so I'm going to be quiet for a minute so that I can share my slides with you. Okay. All right. There. Does that look all right? Seeing my slides? Okay, perfect. So thank you so much for that wonderful introduction, Suzanne. It has really been an honor for me to be able to partner with the Children's Trust Fund. Prior to getting my PhD, I did work in state government. So I was a fiscal analyst with the state legislature in the state of Wisconsin. And then I was a program and policy analyst at the state of Wisconsin Children's Trust Fund. So I really have a long history of working with children's trust funds, and it's been a great experience for me. Because I had that prior experience working in policy, I was really interested when I went to get my PhD and wanted to do research, to really do research that would be able to inform the policies that we were making, helped legislators to understand the realities of families and what really works for them. And so I've been really grateful to be able to be part of this project. So today I'll be talking to you about an intervention that we have going on in Michigan. It's a partnership between Michigan Department of Health and Human Services, Office of Equity and Minority Health, the Children's Trust Fund, and then the University of Michigan. And the name of the project is called Increasing Access to Earned Income Tax Credit to Reduce Adverse Childhood Experiences. So the Earned Income Tax Credit, sorry, I'm just going to move some things around on my screen so I can see better. The Earned Income Tax Credit is a refundable tax credit available to low and moderate income workers in the United States. Because it is refundable, that means that workers can receive a refund check for the remaining amount of the credit after all other taxes are paid. The program is considered to be one of the most significant anti-poverty strategies that we currently have implemented in the United States. This, as you can see from this chart, the amount of money that families can receive from EITC is significant. So a family of 3 in 2021 filing for taxes in April of 2022 can receive up to close to $7,000 from this credit if they have 3 children in the home. So that's a huge amount of money if you think about how much of a significant difference that could make in the lives of a low-income family who are struggling to make ends meet. So unfortunately, although this is a great benefit that can actually put a lot of money back into people's pockets, about 1 in 5 families who are eligible for the credit don't actually receive it. So reasons for this include lack of awareness about the benefit, concerns that people have about citizenship or not having filed taxes properly in the past, stigma surrounding having government help, and then lack of knowledge or motivation in signing up for the credit. So I said that this project is intended to reduce ACEs. So ACEs stands for Adverse Childhood Experiences. There was a study conducted in the late 1990s that was interested in understanding the ways in which the experiences that we have as children can affect our outcomes long out into the future. They looked at these specific types of traumatic experiences that children might have, including child abuse, sexual, physical, or emotional, neglect, physical and emotional, and then 5 different types of family situations that are experienced by families. So intimate partner violence, alcohol and other drug use, a parent who's imprisoned, a parent with mental health issues, and then parents who are separated or divorced. In these studies, in the years that have followed this, there has been a large proliferation of studies examining how adverse childhood experiences relate to health outcomes, and they have found that there is a significant relationship between experiencing ACEs and negative health outcomes. This includes negative health behaviors like smoking, but it also includes negative health outcomes such as cancer and heart disease. So we're focused on the EITC as a possible mechanism to reduce ACEs because there is research to suggest that EITC reduces some forms of ACEs directly, such as parental mental health problems and economic hardships, but also reduces risk factors and promotes protective factors for other ACEs through its positive influence on income and work. So increased income provides a pathway out of intimate partner violence situations for survivors of IPV, and it also reduces poverty and reduces stress in parenting. So we think that the EITC is a really good place to intervene. So for our EITC Access project, we have 2 levels. In level 1, we have a public education strategy that is very low cost and wide reaching. The Children's Trust Fund funds local councils in all Michigan counties, which are dedicated to child maltreatment prevention. We have created educational materials such as the flyer that you see on your left, about what EITC is, how to access it, and then we have various messages on there to try to reduce stigma for applying for the credit, such as you work hard for your family, you earned this credit, etc. These materials are then provided directly to families or to partner agencies that work directly with families for them to hand out to the families. In level 2, in addition to the educational materials that I just mentioned in level 1, we have a home visiting approach. The Parents as Teachers program is an evidence-based home visiting program that the Children's Trust Fund was already funding. It is primarily focused on parent-child interactions and improving readiness for school. For the EITC Access project, we provided concentrated training to our treatment group home visitors on how to talk to parents about money, earned income tax credit, also the child tax credit after the exciting changes that Whitney just talked about, and financial empowerment. So home visitors layer in this information about the earned income tax credit and about money and finances during the course of their normal visit with the family. So they're talking to them about how to play with their child, and then they're also able to talk about these more difficult issues. For this project, so we have the lovely state of Michigan, or most of it, a little bit of the UP got cut off up here. And this map displays where our programs are currently operating in the state of Michigan. The white counties are not currently receiving anything through this project. They are just getting treatment as usual. They are our comparison counties. So treatment as usual means we're not doing anything special related to EITC in these counties. The light blue counties are receiving our level 1 educational approach. So for this project, we'll be using a quasi-experimental design, which means simply that we're going to match counties that are similar demographically that are from the white counties on this map to the light blue counties on this map. And we will be looking at county level EITC take-up and county level maltreatment rates to compare whether our public education approach is making a difference. The dark blue counties and mint green counties represent our treatment and control group counties for level 2, which is our home visiting approach. The light green counties are receiving just parents as teachers, the usual approach with no specific training around EITC. The dark blue counties are those that are receiving the Parents as Teachers program with the additional EITC. So for these, in addition to that administrative data on the rates that I just mentioned, we're collecting surveys every 6 months with families in both treatment and control to assess the extent to which EITC Access project reduced ACEs and increased EITC take-up. So we're really excited about the potential for this project. We hope that it will improve practice to layer in specific attention to the social welfare policies. You know, our policies are only so good as the people who take them up. So if we have a great policy, but families aren't taking it up, then they're not benefiting from it. Additionally, we're also hopeful that the findings will improve policy by informing policymakers on effective strategies for improving take-up of benefits. So I'm going to close with just a quick poll on EITC. True or false, earned income tax credit is considered one of the top currently existing anti-poverty strategies in the United States. Thank you so much for your time. I'm going to hand it over to you, Raina. I think you're muted, Raina.
Can you hear me now? Hi, my name is Rachelle Smith. I'm with SOS Community Services in Washtenaw County. And we have a home visiting program that services Washtenaw and Western Wayne County. Being able to provide services, direct services to families in the community gives me the opportunity to work with partners such as U of M and Children's Trust Fund to provide, well, in regards to this particular program, the EITC, to give family resources that they did not know that they had previously. We see firsthand how families and their children can benefit from this research and will hopefully be duplicated in other communities. As Dr. Jack said, we go into the homes and we have been trained previously by U of M to talk to families about how they can get this earned income tax credit. And we do this, while going through the different questions that we ask. And while we're asking these questions, we're learning even more about our families that we serve. It's almost like going through another protective factor survey. You learn more about mental health, the deficiencies. We have so many families that have deficiencies with food and just domestic violence, child abuse that families worry about. And we want to make sure, that our families are getting everything that we need, especially during this time. We have a lot of families that are struggling with mental health. And so when we talk about, extra income that they may receive, at times they can be pretty leery when filling out surveys, but when you start to talk with them more about what the outcomes could bring, then they become a little more open to it. We had a single mom that's in our program who reluctantly participated in the program, and she became very interested. And, she learned, especially from the printed materials. I can't tell you how great the printed materials are, especially the booklets. And she began to go through and she started asking more and more questions. And she was able to start planning and making better decisions and going back through her taxes and using those resources, and was able to move her son and herself into a safe and stable environment. And that's what we like to see. And this kind of research provides life-changing opportunities for families and children. And what I have learned, through U of M and through CTF and Parents as Teachers, is that the research that is done is beneficial to families and children. It reduces ACEs, it provides opportunities for families to put their families in a better position in life, and therefore breaking the cycle of poverty.
Raina, I think we can hand it over now to Meg Feely.
Yes.
Hello, thank you so much for having us here today. Michelle and I are going to talk about another aspect of working with communities, and as a way to help them develop skills where they can transform their own communities to be healthier and safer, particularly for children. So this work is part of a larger CDC funded project to prevent adverse childhood experiences. Katie very helpfully kind of went over that a little bit. I'm involved in the project as a child maltreatment researcher because about half of the ACEs are child maltreatment, and many of the others are risk factors. Our Office of Early Childhood is the lead agency, but there are a number of other state agencies involved. So this is really a sort of cross-state effort. The Department of Children and Families, Department of Mental Health and Addiction Services, and the Department of Public Health are all involved, including, and in addition, there are some local organizations like CT Data. So there are three kind of major foci. Can you go to the next slide, Michelle, of the grant? And they are to, one, increase the availability and access of ACEs related data. So not just self-reported ACEs, but indicator, social determinants of health, protective factors, et cetera, to implement ACE prevention programs, several of which are in our state are focused on increasing economic stability, including trying to increase uptake of EITC using some sort of very similar approaches that they're using in Michigan. And then to use that data to both revise kind of how the prevention strategies are targeted and focused, but also to generally increase use of the data, particularly in communities that have a high ACE burden. So to do this, we need to build the skills of people in the communities so that they can feel comfortable using the data and really can actually use that. So this is part of data literacy. So data literacy is a developing field, and there are several different definitions of what it is. Michelle's going to talk in a few minutes about their working definition, but kind of broadly, it's the ability to read, work with, analyze, and argue with data as part of a broader process of inquiry into the world. So it's not just being able to read a chart, but you being able to use that chart and the information sort of in a more transformative way. It builds on open data initiatives. Connecticut has a large open data initiative, but open data kind of creates a house for data, and data literacy by developing those skills lets people walk through the door and actually benefit from the house. There are different approaches to working toward data literacy, from kind of the way most of us are probably trained in a very traditional statistical focus in a school setting or university setting, all the way to very non-traditional, non-technical approaches. They're still using quantitative data and qualitative data in some cases, but the approach is very different. So let's go to the next slide. And they're different. A key piece of this work is about kind of shifting power away from the elite institutions that currently have most of the information, and not only sharing the data through open data initiatives, but actually empowering individuals and communities to access that data. So interestingly, as I started to do some research on kind of the sort of more formal background of this, it turns out that unbeknownst to them, that CT Data was using many of the principles of data literacy that draw on Paulo Freire's literacy and pedagogy of the oppressed. And those are to contextualize the information and to understand the context of the people that you are working with and what is relevant to them and why, to identify information that would be relevant to the issues that they have brought up and are concerned about, to work with them to critically analyze the data. So questioning things like, where is it from? Who collected it? Why did they collect it? What was the purpose of the data? What's missing in the data? And what does the data hide and what does it show? And then to use that information and that critical analysis to see the context of the data differently in order to be able to move to change or move to transformation of their lives and communities. And so now I'm really thrilled to introduce CT Data. They're an amazing organization that does really groundbreaking work. Michelle Rita-Nold has been the executive director and the leader of this organization. She's going to be very modest and downplay how amazing they are. And time's not going to allow her to cover all of her work. So I strongly encourage you to go to their website and see the full range of the data that they've made available, the data related trainings that they've created, data visualizations, and the data stories that they use. And with that, I'm going to turn it over to Michelle.
Thank you, Meg. Hopefully the blushing isn't showing through on the Zoom video, but thank you for that. So I'm going to talk a little bit about our work in the state, and then and how the work we'll be doing on the PACES with initiative with Meg. So this is the mission of our organization. We're striving for informed decision making, and we empower an ecosystem of data users by democratizing access to public data and building data literacy. So that's a mouthful, and what does it really mean? So what we strive to do is make data accessible. And so I've put up here a bunch of different data tools. The open data initiatives have made open data available, but what we really stress is accessibility so that people can use and engage with the data. So an example of this would be a project we did last year for Get Out the Vote efforts. So a local foundation was funding different community organizations in the state to help get out the vote. However, they had no data to work with. So we created this tool which allowed, we provided census data which showed the population of, at the census tract level of unregistered voters. And we provided also DMV data of potentially unregistered voters so that they could target their get out the vote efforts. So it's just one example of just making data more accessible for users. And as Meg alluded to, we do have a working definition of data literacy. So what we realized in our work is we can put lots of data out there through these what we consider accessible tools, but it doesn't necessarily mean people know how to use the data. So we have in 2017, we launched what we call the CT Data Academy. And so this is our working definition of data literacy. And what we really stress is being a critical consumer of data. So understanding how data are collected, who's in the data and who's not in the data, and how it's shared and interpreted. So we hold a whole bunch of, through our academy, we hold a whole bunch of public education data workshops. And we conduct these across the state and for community groups as well. All of what we try and do is whenever we put out some kind of data tool, we also include a component of data literacy. So often those can be data walks that we host. So it's a way to then present with the community, present the data, but it's also an opportunity for the community to then engage with the data. So when we were in person, we did a project called Health in Hartford's Neighborhoods, where we looked at the relationship between health and housing. And we put the findings up in a room and gave invited the community to come and gave them all a sheet, which included the metadata and then questions, and broke them up into groups, and they could go around the room, look at the findings, and talk about one another. How does this relate to you? Is this what you thought it would show? Just talk about the different findings. However, in the COVID world, where we're doing everything virtually, it's a little bit more challenging. But last year we received a grant. It was from RWJF to use data to inform local decision making on COVID. So we, a university, partnered with some local nonprofits, the Sudanese House, Hartford Health Initiative, and a few others, and had them conduct a survey among their clients and to see how COVID was impacting them. So you might be familiar with this kind of data output from a statistical software program. And so this was what was presented to the nonprofits. But our work with the local nonprofits was to really try and help them make the data digestible for the communities so that they could then react and act upon the data. So we then turned some of the data into visualizations like this. And this was really exciting because we held a virtual data walk with Hartford Health Initiative, and it was all women in a particular neighborhood in the north end of Hartford. And when they saw this, they decided to create a walking group in the neighborhood. So it was really, really exciting to kind of to work with the community and figure out, actions that they could take to help improve such stress during COVID. This is another example. Sudanese American House was also one of the nonprofit organizations that participated in the survey. So they surveyed their clients, and then we helped them both understand their survey data, make it more digestible for their members, but also to add in secondary data to understand themselves in the context of Connecticut. So this was exciting because you had the Sudanese American members. It was the first time, they said they see themselves in the data, because oftentimes when race and ethnicity data are collected, they are, they don't know how to identify because of the categories that are provided They don't see themselves in the categories that are provided to them. So that was really an exciting project to work on with them. And then we also have done regional data stories. So this was for a project for the Department of Children and Families, connecting children and families to care. And again, it was a way to engage communities to see, not just to see the bigger picture of who's living in their community, and to look at secondary data about their communities. So we went around the state and we presented these stories to each of the regions of Connecticut, Central, Eastern, North Central. You can see them listed there. And then it provided an opportunity to both show them the data, but then also explain how data are collected, explain sources of the data, talk about how race ethnicity data are collected by, by the Census Bureau. In our first round of presentations, we mentioned a lot about, I kept mentioning suppressions, and realized that that's not a common definition that people know. So then it provided us opportunity to update the stories, and then provided us also like a moment to teach about jargon in the data world. This project also, we shared some health data. We shared some opioid death, accidental, deaths related to opioid deaths, and folks in one community that I presented to, we were looking at the numbers and realized it didn't quite make sense. And then what it turns out, the data are reported by where the person dies, not necessarily where they're from. So went back to the public source and asked them to publish from the where people are from. So that was an opportunity again for the community to respond to what they're seeing, and also help to say, does this make sense? Is this telling, the story that we're experiencing here? So those are a couple examples of what we do and what we're going to do. And so I'll turn over to you, Meg, to wrap it up.
So when Michelle and I, so to kind of sum up what Michelle covered, in some places they were able to provide for the first time to show people their lives in relation to the rest of the state. So it was the first time that community had really felt seen in a data presentation. Usually they're just kind of rolled in with other groups and they can't ever see. In another group, they were able to move from information and data to action to improve their health. And they were able to have that conversation and sort of move in that direction by seeing the data presented in a way that was relevant and interpretable to them. So as Michelle and I were putting this presentation together, I was asking her kind of what other places could do to increase the use of data in their local communities, because most places don't have something like CT data. And so some of her recommendations were things like really go out into the community and listen, understand their context and what their concerns are, learn to present the data in a way that is much more compelling and relevant, because you want to not only have them understand the data, but also in a way that engages them and makes them interested in asking more questions and trying to understand better what's going on in their own lives. Make the data more accessible to communities by bringing it into the communities rather than expecting them to come to us. To both like listen to what could be relevant, but also where people's skills are and what they do and don't understand about kind of where the data are coming from, and really looking at that kind of data biography of how it shows up, so that it's not presented as like capital T truth, which we know it's not, but that sometimes is how it comes across, not just from researchers, but in all different kind of forms of communication. So CT data says a lot that we want to get the data into the hands of the people who are in the data. The families that are at highest risk for ACEs are much more likely to be in the data than they are to have access to and use the data. And we really want to change that so that local communities can identify for themselves what they think is best for their community, to work with, sort of allow them to join with other communities to both identify solutions, but also advocate for major changes that are what they want, rather than what Michelle and I might see in the data as the obvious solution. So I just wanted to thank the rest of our PACES team. I'm sorry we couldn't cover more of what that great project is doing, especially the Connecticut Office of Early Childhood, who's been an incredible partner through this process, and Kate Parr and Simone Powell, who are part of the UConn Office of Early Childhood Partnership, and Michelle Ritter-Nold for being a really wonderful partner in this, and all of the current and former staff of CT Data who helped create this really incredible and transformative organization. That's all we have today.
So I think Brenda is up next. Brenda Jones-Harden.
Yeah. Hi, everyone. I am so appreciative of this opportunity to be a discussant. It is a great role for me because I always learn so much about what folks are doing in the field. And it's also great for me because I don't have to really plan to do a big PowerPoint. So I love this role, and I want to thank my very good colleague Todd for allowing me to have it. So I did do a PowerPoint just to organize myself, and I'm pulling that up now. Like Katie, I'm really bad at, let's see, at multitasking, but I will try to get this up. So bear with me for a second. I don't know why it's not coming up. Slide, let's see. All right, okay, let's see. There we go. It's not at the beginning, but there we go. So I'm going to offer some reflections today to you all on the great talks that I have heard. And the first thing, the first thing that I want to sort of say is I learned so much about these wide-ranging topics and the import of these topics for the rates of child abuse and neglect, but also thinking about the sequelae. So I'm going to offer some comments on all three of the presentations. And then I want to, of course, put in some of my own ways of thinking in this, right? I get to talk to you all, so I have to put my own perspectives in here. So first, thank you, Whitney, for telling really the audience so much about this child tax credit and looking at three different ways to think about it. I think there were many wonderful things that you covered, but two that really hit me was that although you were talking about a fairly universal intervention strategy, a universal policy, one of the important outcomes, I think, of what you talked about was that it really seemed to have the most impact, one, for families of color, but also for the lower income families, as you suggested. Once the child tax credit really became more accessible to families of lower incomes, you started to see the findings that you talked about in your first study. So I think that's really a critical, important point that came out of your discussion, because oftentimes, particularly people like me who hear universal, think, oh my goodness, they're taking money away. We should target it to families who are more at high risk for child maltreatment. But what your research says to us is that that kind of universal population-based approach has the potential to lift the boat, even for those very, very high risk families. The other thing that you said that really sort of hit me were the outcomes that you looked at. Certainly, we know that injuries are often a proxy for child abuse and neglect, and really injuries are pretty small. I mean, the rates of injuries are small. So the fact that you were able to have an impact on that speaks volumes about the power of these kind of interventions, because really you don't see these injuries in large groups in the population. And the behavior problem problems finding was equally compelling because, as we know, we have to think about child factors that unfortunately elicit compromised parenting from families. And your finding about behavior problems, I think, is critical, not just for that, but also for kids' long-term well-being. As we know, even behavior problems in early childhood predict conduct disorder and all kinds of other things that are not good for children in later childhood and adolescence. One question that occurred to me is whether, when we think about these kind of major universal policies and their impacts on kids and families, whether that might be in some ways a proxy for a state or a local jurisdiction's approach to serving children, whether the fact, because we can't do a randomized controlled trial, right? So we're just looking at associations. And I often wonder whether a state like those states you mentioned at the beginning that had done earned income tax credits, whether that really is a proxy for how a state views their children, how they take care of their children in a broader way. So I want to make a few comments about the next presentation as well, the Earned Income Tax Credit and ACEs. Just really appreciate this work. I have watched how we have moved from looking at ACEs just in terms of the prevalence in the population to all these other very interesting questions. And this particular presentation certainly looked at that. So one of the things that I thought about when you all talked about this was this focus on public education, and how that again is another sort of universal strategy to get the population to understand what you're talking about, and how important that is, not just for a community to know how much risk exists in their own communities, but also to really reflect on themselves and what they see in their families and what they might want to do, and how that might argue against the stigma, for example, of mental health treatment and those kinds of things. I also was fascinated about your initiative to use home visitation. I'm a home visitation fan. I believe in it, have been doing it for a long time in my own career. And I think it's very important to use existing gatekeepers to try and get to families. And certainly you all have used it with parents as teachers in Michigan. I mean, one of the questions that I had about that, however, is I know for McVie, there are so many requirements of home visiting programs and providers. And I just wondered how much this was causing home visitors even more stress, to have more, things that they had to do in terms of, making sure that they talk to families about the Earned Income Tax Credit. And the other question that I had was about this issue of families who really don't know that they're eligible, and you all raised that issue, but also the families who just never, ever file taxes. I mean, there is a large proportion of the impoverished community who never even think about filing taxes. And I just wondered, whether there were any efforts to try and get to those families and help them understand how they could use this particular policy lever. And then finally, the data literacy presentation was also really compelling to me, and I really liked that phrase, the democratization of data. I think I'm going to steal it and use it in my own lab, so I really liked that. I really thought the stories to communities were really compelling, particularly when you could look at regions or subgroups like the Sudanese. We have a huge East African and Sub-Saharan African population in my area, and not West African, but East African, and they always are saying they never hear anything about their community. So the idea of going into a community and letting them know about their data was particularly compelling. One of my questions was, what do we do? Is there a way to help them think about the actionability of data? So it sounds like you all have done this great work, data visualization and all this kind of stuff. Is there a little handbook that, for example, that Sudanese group could get that helped them to make the link between what they learned from the data and what they could do. I mean, certainly I think academics are still struggling with that. So certainly communities who are using these data could benefit from that. So I'm going to move now to just some other thoughts that I had that sort of came up for me from some of these talks. So first of all, I just wanted to say, and all of us know this, that child maltreatment is really a multifaceted phenomenon. It's kind of like a wastebasket term that includes a million different ways of parenting that are not helpful to children. And I was thinking about this across all the studies, but in particular, Whitney's study on the child tax credit and how she found data on injuries and behavior problems. And that's really, in some ways, very different than kind of the neglect that we see that has to do with poverty. I mean, one could argue that the injuries are about failure to supervise, but the poverty related neglect that we often think about are, not getting, food to your children, not putting them in a good housing situation, those kinds of things. So I wondered whether we could look more specifically at those poverty related neglect parenting strategies and whether we saw some of these universal policies affecting those. I also was thinking about the ACEs and thinking, okay, so we know a lot about ACEs experiences, and we've got the Feely et al. And all these other people who've looked at long-term outcomes. But I wonder if we could, sort of drill down on that for some of the populations that we were talking about today, and whether we can think about not just whether, things like earned income tax credit affects the prevalence of ACEs, but what it really means for kids' outcomes. I mean, there is research, of course, that suggests that not all kids who experience ACEs have these kind of negative outcomes, that there are other kinds of mechanisms or protective factors that we kind of addressed a little bit today that might, affect whether these kinds of experiences affect children's outcomes. And I would love to see the research take that next step to go from prevalence to looking at sequelae. And then in terms of the data, I really, really am trying to push myself to be a real community-based participatory researcher. And I've got pieces of it, and I think certainly we heard pieces of it today with some of the projects that were talked about, but not just to think about families and populations and communities as consumers of data, but as people who are going to walk the journey with us, who are going to help us define the questions, who are going to help us define the methods, who are going to help us understand our findings and things like that. And I'm certainly not here myself. This is, one of those ideals that I have, but I certainly think this last group we heard from really has the potential to move us in those kind of directions. Couple other things I want to say. Todd, of course, would know I would say something about this, about looking at things from a developmental perspective. And certainly many of you on this call probably know about a variety of sources of data that suggest we need to take a developmentally centered approach to not only our programming, but our research. And this is just one of many studies that I like to cite. This one is of the Romanian orphanages where they randomly assign kids to Cadillac foster care, which we would never see in our country, versus remaining in the orphanage. And as you can see from this graph, there are very different outcomes depending on the age of the children. So the kids under 2 looks like, the orphanage experience did not have as horrible an impact. It had an impact, but not as bad as if they were moved out of the orphanage after 2. So this is just one of many studies that suggest, that we should be looking at these kinds of things. So instead of controlling for age in the way Whitney talked about in her first study, that we want to separate ages out and think about what these things mean for families with children of different age groups. Similarly, from a prevention standpoint, I'm a prevention researcher, although I've done some child welfare work with foster kids and special needs adoption early in my career. I'm a prevention person in terms of my practice and my research. So this is just another piece of data, and I'm sure Dr. Reardon would probably say we can do this a lot better, but this comes out of Harvard, where they were trying to do the same kind of thing, use data in a way that people could access. But this is about the brain's ability to change in response to experiences. And what it's arguing, of course, is that you get more bang for your buck the earlier you intervene. And we could sort of impose this same kind of graph on another kind of text where we talked about return on investment from an economic perspective. So again, just another push to think about how these issues that have been raised today really might be different depending on the age of the child that we're addressing. I also want to go back. Whitney talked about this sort of public health approach, and it's an approach I really believe is critical for us, not just in the way Whitney talked about it, but also from an intervention standpoint. And certainly the child tax credit and the earned income tax credit that were discussed in the first two presentations sort of land us right in this primary prevention space. The data take us across all of these, and certainly one might want to be thinking about what's happening with early care and education in the community, what's happening with mental health services in the community that sort of take us across these prevention strategies. But also, I think, again, one could say, let's look at what do these things look like in context where there are these universal levers as opposed to places where there aren't. Last couple things I want to do is remind us that although we're talking about very, very important policy strategies, very important macro level strategies to reduce child abuse and neglect, that it is a very complex phenomenon. And I really love this. This is really about, they sort of call it the pair of aces from Ellis and Dietz, a paper written in 2017. But I love this because they use a sort of, image that I like, trees, I love trees, to help us think about the complexity of this phenomenon and how absolutely we have to think about all those root causes that hopefully many of the universal policies that were discussed today will address, like poverty. But there are so many other things that child maltreatment researchers and practitioners have to think about that are related to poverty, but certainly, I often call the families I work with the poverty plus families, because if you're just experiencing poverty, you don't necessarily see child maltreatment outcomes. And I want to make sure I say that loudly and clearly, that the data do not suggest that just because you're poor, you're going to maltreat your children. Yes, it's more likely because you've got all these different things that this particular slide shows, you're more likely to experience these things, but there are a lot of poor families who do not go on to maltreat their children. So the question is, how do we as practitioners, as scholars in this field, really try to tackle the myriad ways that families are affected that lead them to do something that really is inconsistent with us as humankind, and that is maltreat their children. My last slide is just to build on that and suggest that we really have to think about this. Just like we know the root causes, the causes are very complex, our intervention strategies have to be as complex. We have to use the income supports that were talked about today, but also use them in concert with all these other kinds of services that are designed to address the very, very vulnerabilities of families that we serve in the child welfare system. So thank you so much for allowing me to share those thoughts. And now Todd and I are going to look at some questions, right, Todd?
There's on mute there. Yes, we are indeed. And I was asked, Meg and Michelle, if you would relaunch your poll. I think that there was an issue with that. And while you're doing that, Brenda, I just want to thank you. I mean, you always provide such words of wisdom around these topic areas. And I think that, you know, the perspective that you bring, and I do count on you to bring up that developmental kind of sensitivity. You do it, and you do it so well. And I think drawing, you know, our attention to the complexity, not only of the underlying issues and problems, but also of the need for multifaceted and equally complex interventions, you know, I think is important for us, an important note to sort of end on. So thank you so much for those remarks and for sharing your perspectives with us. So we do want to open up the floor now to questions that you all have. And Emma, maybe I'll start by asking you if there are any questions in the chat that we could begin with, and then we'll invite others to offer their own.
Before we do that, I'm gonna let Meg, do you want to comment on these results at all?
Yeah, so I actually asked if we could relaunch the poll because I was actually curious about the answers. And this is helpful. It's interesting that half of the respondents said that using too many technical terms when explaining the data or results. So less of an issue with answering questions the community is interested in. And these are really fixable problems, just, you know, kind of in our, even at the stage we're at now of kind of as we go out and disseminate results in different contexts and really thinking about what terms we're using and how to explain, and also trying to figure out how to understand the context of the data better. So thank you. This is it's interesting kind of breakdown.
And then Todd, there was a question in the chat and then a comment. So the question in the chat, it was just asking how to access the Columbia CTC study, if anyone has the answer to that.
Yes, so the Columbia study on the child tax credit and the National Academies of Science report, that simulation research, we're hoping it will be published within the next 6 months. So those results won't be available until they're published. So we've just been disseminating the results through various presentations, but hopefully we'll get that accepted in a journal as soon as possible. We all know journal reviews are taking a little longer during the pandemic, so stay tuned.
Well, as we're waiting for other questions to come in, maybe I'll pose one to the panelists, myself and Brenda. You should do the same. You know, Brenda, I think you commented on some of the issues around universal prevention strategies and just what we know and what we don't know. And I think each of the panelists spoke to the potential benefit, right, of one universal strategy here, or one type of universal strategy. I wonder if any of you might be able to speak to the mechanisms of change. In other words, why would we expect that income supports, for example, would benefit families and reduce child maltreatment? Can any of you take that up as a starter?
I can go first, and then Whitney, you probably have a wonderful response as well. So I think that, you know, we expect, so as Brenda pointed out, which I think is so important, you know, most low-income families don't maltreat their children, but being low income provides a number of different stressors. It increases your likelihood of having different stressors within your family. And there has been this correlation between being of lower income or not having enough resources, having more economic hardships, and child maltreatment. And that shakes out both in entry into the child welfare system, but then also in self-reported child maltreatment behaviors that we see within the research. So thinking about the mechanisms through which that happens, we see, increased levels of stress. Certainly, if you are unable to make ends meet and pay bills, you probably are experiencing a lot more stress, right? We also see things that are considered to be child neglect can also be definitionally in state statutes are usually separated. It says for reasons other than poverty alone, but in practice, it is sometimes hard to distinguish. So we sometimes see families come into the child welfare system for things that are related to poverty, like being unable to have a safe place for the child to live, for example. So those are two mechanisms. And then having fewer means can increase or decrease the likelihood that you're able to get help or access to services for certain different social problems that you might be experiencing, like mental health issues that appears across all different socioeconomic statuses, but may make it more difficult for you to be able to access services to help for that. So the idea is that through increasing income, then we can see some of the direct paths, right? Like, so if you have more means, then you're less likely to have some of those behaviors that are in practice treated as child neglect, which are really just child poverty, but then also it will increase your income and access to resources, allow you to have more funds available for childcare, for example, which allows you to have your children supervised and also provides you with some respite time. I say that as a parent who has kids who attended childcare. So I think that, we both see it with the direct links, but then also through these indirect links of things that relate from the income to child maltreatment. So providing you with more resources and more opportunities in order to be the type of parent that everybody wants to be. But I will let Whitney answer that question as well, because she probably has a diagram about this.
No, I'll just add, I think there's a lot of research on poverty in other areas that if you're constantly worried about how you're going to put food on the table, where your next, how you're going to pay for your next month's rent, if you're kind of constantly worried about meeting your basic needs, it consumes a lot of your cognitive bandwidth, right? And so when families are more financially secure, it frees up that bandwidth to be more sensitive and responsive in your parenting. So we've seen this in lots of research on poverty, that it just is a very time and energy consuming state to be in. Secondly, I will say, a lot of the research that we do around maltreatment relies on NCANS or AFCARS data, and that is all data, not maltreatment per se, but what the child welfare system what's reported to the child welfare system. So I think we don't have great data available that actually says this is actual maltreatment. Just like Katie said, a lot of the neglect cases are probably confounded with poverty. So it's also a kind of a visibility hypothesis. So as income increases, you're reliant less on these kind of social services and programs, and so you're less likely to be around mandated reporters. So the less you have to rely on these social programs, you'll have less visibility of mandated reporters. So that's all I would add to Katie. Katie, you did a great job.
Todd, there's a question that Raina wanted to answer about the food banks. Raina, do you want to go with that question?
Yes, in regards to the food banks, yes, people are still struggling with putting food on the table. SOS actually has a pantry, and what we are seeing is that even though we have food banks, people are struggling to get to the food banks because of lack of transportation. If you do not have a car, then it's hard to get to the food bank. Even if there's a bus, it's hard to get to the food bank if you have 2, 3, or 5, or even 10 children, because you have to manage your children. So what we have done is started with our home visiting program is delivering food to our families that are not able to get to the food banks. They can go online and they can order, but everyone does not have that opportunity, to do that at different food banks. So whereas we are able to do that, everyone is not doing that at food banks. So, that's just an answer to that question. Yes, people are still struggling. And, even if they have EBT cards, a lot of children are home from school, especially during COVID. Children are eating more. Parents are saying, you know what, I did not know my children ate this much. And so it's like, I need food. I need more food because, my kids are growing and they eat more than what I have. And so, it's hard when you have a large family. We have a young lady who has a family of 10, and it's hard for her to keep food on the table, and she has no transportation. So it is hard for families, but that's an answer.
Todd, I was gonna take the question about the research on family spending patterns a little bit. So somebody in the chat said that there's concern that families might be using the tax credits to buy flat screen TVs, et cetera. And there is actually research coming out that they do not. I'm so happy because I was so sick of that argument, but I didn't have any data. But for example, in the RAPID project, which is sort of been this survey that started, it's not my work, I don't do this kind of work, but they have been surveying families of young children since the pandemic started. And of course, as you all know, there are these junctures that they can look at. It's not an experimental design, but they can look at what happened after Freddie Gray. They could look at what happened after the child tax credit. And so they've been adding questions all along to address some of these things. So they've added some questions about family spending habits post child tax credit, and found that families report spending most of the money on bills because, like Raina said, families are food insecure, but they're also housing insecure. So they do a lot to pay for bills. But the other thing they do is buy stuff for their kids. I probably shouldn't even be talking about this, but you all know that there's also a study that Greg Duncan is doing where he's randomly assigning, and his team, right? It's not just Greg Duncan, it's people at University of Wisconsin, et cetera, Columbia. They're randomly assigning folks to get unconditional cash transfers. And they're finding similar things, that families are not buying big screen TVs.
Brenda, if I could just add to that, I'm really happy you brought up these guaranteed income pilots that are popping up all over the country. And I think the same is, they're finding the same thing. The Stockton pilot, I think, which is one of the earliest universal basic income pilots that started a few years ago, and they found similar things. People are using it to fix a car that's been sitting in a driveway. People are using the money to start their own business. There's a guaranteed income pilot in Mississippi where they targeted single African-American mothers. Some of those mothers were able to buy their own homes. So we're seeing kind of these really huge positive benefits for these really guaranteed income pilots all over the country. And Columbia is actually tracking how people are using the child tax credit as well. So I'm sure we'll see more and more evidence for families not using these tax credits in a frivolous way.
I just wanted to add to that really quick, if it's okay. For the EITC project that we're doing in Michigan, we did provide the home visitors with financial empowerment training. It's a training called Your Money, Your Goals, which is available from the Federal Consumer Finance Bureau. It's free for anybody. Anybody can look at this. There's an awesome financial empowerment toolkit that you can download, or you can have them mail it to you for free. They have a whole bunch of booklets. And so part of what we did with the training, it has materials on prioritizing spending, which bills to pay if you can't pay all your bills, which ones will affect your credit more, how to avoid different scams, financial scams, payday loan places like that. And so part of what our home visitors are able to do is to help the families really plan for when this big chunk of money comes in, how can you make the best use of it? And it's not done in a way that's demeaning about don't spend it on a flat screen TV, but it's done in a way that says, let's look at all the bills that you have coming in and are unable to pay at this time. And let's think about how to make the most out of this. So that is part of what we included within our training.
I also wanted to add that I think even this, like, our quick push to defend, like, no, nobody's spending this on flat screen TVs. Nobody asks us how we spend our money. I used a flat screen TV a whole lot during the pandemic, and actually this week when my children were homesick so that I could keep working. And that was how they were entertained. They stay still. They don't hurt each other. They don't break things when they're watching the TV with a big flat screen TV. And well, I think people should be allowed to make choices about what they need for their families. And this idea that somehow if you're poor, you don't get to make those choices. And if you're middle class, you can spend your money on whatever you want and that's okay, I think is kind of problematic. So yes, people are spending money on their kids. They're saving money. There was, I think it was in the New York Times, there was a breakdown by race, ethnicity of how people were spending money. But I think it's not always obvious to an outsider, like what is useful for an individual family in a specific time. And I think we should just really keep that in mind as we think about like how we ask the questions about what people are doing, and not just what they're doing, but why they're doing those things, and make sure we listen to why they've made those choices for their families. Maybe they haven't had a TV for a year and they've been home with their kids off and on, during the pandemic, and this gives them respite because they don't have other childcare and it's not super safe to play outside, or they're in an area that's a high density and their kids still can't be vaccinated from COVID. So I just wanted to put that out there, like as we're kind of moving through this conversation.
Thanks for that, Meg. Let's tackle another one here. Rebecca asks, commenting specifically, I think, Brenda, on the one of the figures that you showed with sort of the roots of ACEs, asking about systemic racism and whether there's any evidence or whether there are any efforts, I guess, underway to address systemic racism as a source of risk for child maltreatment and what we know about that. Anybody want to take that up?
So Connecticut's a really tiny state, for those of you who have never really looked at New England carefully on a map. But it has been really trying to, or a lot of parts of it sort of actively grapple with this issue. And there was a bill in our state legislature and our General Assembly to actually declare racism a public health crisis and approach it from that perspective, and sort of look at how it infuses all these different parts of our society in really negative ways. So obviously it has negative individual effects, but they relooked at the PRAMS data around pregnancy and pulled out the information on both birth outcomes and pregnancy experiences and racism or other forms of direct oppression experienced during pregnancy, to try to really start to build, really lay this out, to make this more visible to the rest of society of what our cost is. So that is one approach that is being taken. And in our PACES grant, another thing we talk about a lot is sort of how do we center equity and look at, and that's one of the ways that the data are useful, is what are the areas that sort of had the most need for these for different types of prevention programs, or what are the sort of policies that would be most impactful at this point to create a more equitable society that is more directly attacking that the structural racism issues.
I also think we just need to be closely monitor, the earned income tax credit. It has a lot of bipartisan support. It's a very popular policy. It's a very has significant impacts of poverty, but even it has its downfalls, right? A couple of years ago, there was some research out of, I think it was Bloomberg, that showed that counties in the South that were majority Black or African American, primarily low income, there was increased audits of households who claimed the EITC. So just thinking about how, if you're more likely to be audited, what does that do for future, incentivizing you in the future to claim that policy? Similarly, with the child tax credit, as I mentioned, the child tax credit has historically excluded very, very low income families who are disproportionately families of color. That's why I think this version that we're seeing rolled out right now is so exciting, because it's not really excluding anyone anymore, though families are certainly being missed. Those families who have never filed for taxes may not be aware of the benefit. So we have to be very hyper vigilant about these policies as they're being implemented, because I think there are even of the best intentioned policies, we do see unintended consequences that can further widen inequities.
It's such a good reminder, Whitney, and I think that several of us have been involved in other conversations recently, right, about the importance of implementation research and really trying to understand what are the barriers and facilitators, right, to policy level and practice level kinds of initiatives. And I would agree that probably far more attention needs to be paid to kind of issues around implementation, both to ensure quality implementation and also to identify unintended consequences, as you're suggesting, of any intervention. Suzanne, I was going to turn to you if it's okay. You spoke earlier in your remarks about the Children's Trust Fund here in Michigan and some of the things that are underway, referring, I think, specifically to working very upstream. Do you want to say more about that? I ask in part because I think that there probably are many people on this call who live in Michigan and are probably interested to know about prevention in the state.
Absolutely. We actually fund primary prevention programs in each of the 83 counties. There's 73 programs that cover those 83 counties. And those primary prevention programs range from everything from anti-bullying in the schools to providing mandated reporting to community public education sort of campaigns, safe sleep information, everything that really is back to a little bit more of a universal slant, and working very much in partnership with schools and hospitals and others that are on the front lines, childcare providers on the front lines for our children and families. The other, and we also, of course, do provide parent support and education, but it's much more universal in nature, right? And doesn't require any specific targeted sort of challenges within the family. Whereas our secondary prevention programs, and we have about 30 of those currently around the state, and those programs, like Rena discussed, those programs are working with families that may have a few more challenges, but are not in the system. And our goal is to really provide the supports that need to be in place, those concrete supports that is a protective factor for families. So it might be a parent support or home visitation within the home. It could be a parent support group outside the home. Frankly, when we first started getting into home visitation, the stats were something like 50% of parents would not let anybody in their home. And so it really got to be like, okay, well, this is a voluntary program. We need to make sure that there's other ways. There's no wrong door, right, for folks. If they want help to raise their children, being a mom, mine are grown and both go blue, by the way, but they are both grown and I know that they, the challenges of raising children is so ever present 24/7. And even if you have all those supports in place, it's hard work. And so we're constantly trying to figure out what other strategies we can use. And so whether we discover that, wow, home visitation is really helpful, but then we also need that component of additional online education or texting or perhaps a support group. I've watched as parents connect with other parents, both whether they're teen moms, whether they're grandparents stepping back into the parent role, whatever it is, to have that support, not having family nearby, somebody who understands, it's just really helpful in terms of raising the children. And so that for me has been some of the most gratifying work to see that parents, I believe now after these many years, that parents want to be great parents. They want to be their child's first teacher and all those good things, but it's hard work. And so I think our role is to make sure that they have what they need. And the ITC work is just one of those components that we can be a part of, and connecting to other things like housing and transportation. And you heard Raina say, we can connect them to the food pantry, but if they can't get there, it doesn't really help. And so constantly within each community, I saw one of the questions was, what are you doing around family counseling and other evidence-based programs in terms of prevention, not just the economic aspects, but also the others. And we do have programs that provide counseling or child sexual abuse. I think the beauty of, Todd, the beauty of what we're able to do is ask each of our communities to do those needs assessments and decide what is needed in their community. So Raina's program can do exactly what her community needs and then apply to us for funding. And it really is quite an honor to sit in my role and be able to address those needs. And we look forward to this results of this data so we can continue to expand that and now hopefully provide this sort of information to every parent in the state. Thank you for asking.
Great, thank you for that. And Brenda, while we're at it, it's rare to have an expert like you in a session like this. I wonder if you could speak to the connection. So we've talked mostly about universal policy around income and economic supports. Do you want to add something, just because this is where your expertise is, in that kind of the early childhood space and the family supports? Maybe kind of expand our vision of universal programming a little bit, if you might.
You got 24 hours time? Just kidding, just kidding. I could do it though. No, I thank you so much for giving me the opportunity to talk about that. I really do believe very much in sort of, as Todd knows, an early childhood system of care that certainly can build on the things that Whitney and Katie talked about today in terms of child care. The child care tax credit, the tax credit, the earned income tax credit, all those kinds of things, certainly as a base, but that for the families that we get in the early, in the child welfare system, I would love to see some kind of triaging where we got to these families upstream. For example, in the District of Columbia, where I live in the suburbs. We are now seeing what they call this front door yard policy, where you sort of think about the metaphor is to get the families who are showing risk and bring them into a system of care. And that system of care really includes a lot of things that are sort of traditional early childhood programs, like high quality childcare, like Head Start and early Head Start, increasingly pre-K, because as you all were saying, many of you talked about your experience as parents during COVID, right? We know that that is a mental health intervention for parents and for children, to have kids out of the home, right? So parents can get respite, as Katie said, but also in a high quality early care and education setting where they can get the nurturing that they may not get at home, but they can also get kind of the stimulation they need to get them ready for school, which is another important mental health intervention from my vantage point. So that is a priority, right? And one of my wishes is that every little kid who comes into child welfare gets a priority slot in early Head Start. That's just a wish that I have, because I know that they will get the kind of nurturing care that they may not get at home. But in addition to that, as you all know, many of you know Head Start programming, it's a 2-generational programming. It's supposed to address self-sufficiency, which is not the primary thing that it does for parents, but one of the things that they do is really help parents to understand their critical role in the lives of their children. So not just in terms of being a good advocate for them at school, although that's part of it, learning to be a good advocate, learning to involve themselves in school and all that kind of stuff. But more importantly, which we know from the data, is their capacity to improve their parenting. And that is critical, as you know, for kids in child welfare, right? Where what they're missing is an opportunity to have the what we call the brain expectant experience of being nurtured and cared for. So in these Head Start programs, a major goal is to help parents improve on their capacities to provide that nurturing care. And Jack Shonkoff, as many of you know, has gone all around to every state, Connecticut included, talking to legislators about the importance of that serve and return. And that's the kind of stuff that you get in Parents as Teachers. You get that in Parents as Teachers. You get it in Early Head Start. Another piece, speaking of Parents as Teachers, is having some kind of home visiting component that, you know, allows parents to have a coach. And that's what we're learning more and more in these programs, that it's not just comprehensive, let's go visit programs, and I mean, let's go visit families, and as I say to my students, you know, sit on the couch and talk to them about, you know, developmental milestones. That's not what we're learning is important. What we're learning is important is the coaching in the context of those in the moment parent to child interactions, and that the home visitor, if they're really good and gets good supervision, is doing that kind of thing. And what it allows parents to do is transfer those skills that they're getting in the moment with the home visitor to times when the home visitor isn't there. And we got all kinds of data now from a variety of programs that show that these efforts really do make a difference. Now, what we don't know as well as we should is how these programs should be adapted for kids in child welfare. And so we need to do a lot more work around, you know, do we need higher levels of intensity, for example? Like a lot of the home visiting programs might get to a family once every other week, even though they're supposed to do it once a week. Do we need to go out to these child welfare families multiple times a week? I mean, those are the kinds of questions that we still need to answer from a research perspective and a practice perspective. So what I would argue for is a, you know, systemic approach that includes high quality, can't just send them to any little old childcare place, but high quality early care and education, a good solid home visiting program, and a good solid parenting program that really can be integrated into home visiting or into early Head Start that uses this coaching method. There, you know, I love Whitney's sort of pyramid. I mean, there are families at the high end that need mental health treatment. I mean, that, of course, is something that we would want to think about, high rates of depression in these families, et cetera. But again, you know, that's for a smaller group. The larger group, I think, could benefit from this kind of, you know, service delivery strategy that we're hoping to see happen somewhere.
That's awesome. Thank you, Brenda, for that. Let's go back to our panelists and a couple of questions. Jacqueline asks, is there work being done with community credit unions? They focus on financial literacy in the community, starting with children in the elementary school. Anybody have any thoughts about that?
I can talk about what we did for our project. I don't have a wide range of knowledge about what's happening across the country with community credit unions, but I can say for the EITC Access Project, one of the things that we did when we were trying to identify a training for our home visitors on the financial empowerment piece and how to talk with families about money issues, we did reach out to several community credit unions within the state of Michigan, hoping to partner with them and also to see if they had any links for us for volunteer income tax preparers, the VITA volunteers. And we actually ended up not going that route. We weren't able to identify a training that really fit our needs for what we were trying to do. But we were specifically looking for the empowerment piece, not specifically financial literacy. We were really hoping to meet families where they were at. And one thing, because we're working with at-risk families who tend to be lower income, we really wanted to be able to focus on financial financial empowerment for people of all different socioeconomic statuses. We didn't want it to be focused on what stocks and bonds you should invest in, because that just really wasn't relevant for the families that we're working with. So we were really happy with the Your Money, Your Goals training because of its focus for people at all different stages. If you've never been banked before, there's stuff there for you. If you've never filed taxes before, there's information there for you. So that was our experience trying to partner with the community credit unions, but definitely would be a great partner for other people.
Thanks so much, Katie. Let's try to get one more in here. Thomas asks, can the panel comment on universal delivery of skills, such as financial literacy, parenting, et cetera, to reduce stigma due to targeting only at-risk persons? So universal delivery targeting financial literacy, parenting, and other things.
Well, you know, Todd, I can take a stab at it while others think. I think, you know, we know that if you deliver services from a universal standpoint, it does remove stigma, and it makes families feel like they won't be surveilled or monitored, even though, as Whitney just said, it can happen anyway. But I think it does, we have data that it does increase families' willingness to engage in these services. But the other thing that I will just say is that I think the jury is still out on what it means, whether it's enough. I would argue it's necessary, but not sufficient. So yes, I think it's important to do these kind of universal approaches. We know that they make a difference for all families, but I don't think it's enough for the families that we're talking about in child welfare. Look like Meg had something to say too.
Yeah, I think Dr. Jones-Harden, you mean like it's not, they may need additional supports beyond what we would consider in a universal. I think another thing is really reframing something as not like targeted because of need, but something that people are entitled to and is a part of like more typical supports that they should expect. I think the US culture around, you know, kind of, you only get things you deserve or have worked for becomes very problematic when people are offered services. And when we did our McPhee needs assessment in Connecticut, that was a big issue, was people felt like being offered home visiting was someone had judged that they needed parenting support, that they didn't, and they wanted to be able to access that when they thought they needed support, or that have it presented as like, you're going through a life transition because you just had a baby. This is a time people get support, and really reframing, not just offering it, but also reframing it and presenting it differently so that people felt it was something they should have and were entitled to just as like a member of the country, and not because of some specific factor about them.
Good point. We're just about at the top of the hour and out of time, so I think it's probably a good point to end here. But I do want to just thank again our panelists, our discussant, for being here today, sharing their wisdom with us. I certainly have learned a lot. I'm sure other people have as well. We apologize if we didn't get to every question that came through. If you do have questions, we'll try to figure out a way for those questions to be answered. But look for future opportunities to participate in discussions like this. There will be more coming, certainly from our faculty here at the School of Social Work and elsewhere. And again, just thank you so much for your time, and to the panelists. Appreciate it.